All right. Hi, I'm Ashley. Thank you so much for this. Okay, so I guess we'll jump right in. And I guess, what role does communication play in your job? Is it a lot of face to face? Is it a lot like conference calls, a text message? Do you use social media a lot to communicate with coworkers?
Communication again. So communication is a very important part, especially in the job of the healthcare careers. You have to deliver information all the time, and the most important communication is face to face.
Face to face. And I'm assuming it has to be very clear.
Yeah. So depending on the procedure that you're gonna do, it doesn't matter how big or how small it is. We are always interact with human beings, so we have to be sure that our information is clear, and nothing that face to face is gonna change any of this. Any person who is gonna have any procedure, doesn't matter if it's a simple biopsy or a big heart surgery, need to understand all the details on these procedures.
Wow. And then, how important are good communication skills in as being a surgeon? What do you say?
It's very important. I think you have different levels, and you have to be sure that you are delivering the information in an appropriate way. So it's very different to deliver information to a college student than an elderly person, and you have to be sure that you are prepared. You know the person that you're gonna talk first before you meet with them, in order to provide all accurate information. What are the pros, the cons, the possible complications, effects. So it's a very delicate part of our job to that first step of delivery.
So that would have to be like really good at like researching who it is that you're going to talk to, and like the social skills behind everything, like being able to know how to approach that situation. And every situation is different, I'm assuming.
Every situation is different, and you know the diagnosis, you know the prognosis, but you never know the outcome. So yes, you really have to do your homework and know what is the demographic, the age, everything on that patient before even you meet with them. So communication, it has a lot of to do in our job. First, we do some kind of analysis and demographics before we meet with the patient.
Wow. So then I guess, how important would you say, if you were to rank them, would oral speaking communication be? How important would listening and writing be? If you had to list all three from most important to least.
Listen, writing, and what is the other one?
Oral communication.
Oral communication is the most important. Even if the person cannot write or don't understand in writing that information, you have to be able to explain it verbally. And just sometimes we write, we do analogies, and we say, okay, listen, this is how it's gonna be inside. You know, how long you're gonna cut your skin, things like that. So you have to show visually that person the procedure.
And then would you say listening and writing, would that be second or third?
Yeah, I think that's the second part of the intervention, is when the patient, after receiving that verbal notice, understand and a comprehension of what is tell until the entire procedure, receive that information in writing.
So listening would be very, and then at the third.
I think the listening part is some people is wanted to express, and other people, most of the people get kind of in shock or just in silent mode. And so we have to wait until after, when they come back, and after the reading, they get the notice and they have questions for us.
Wow. So would writing, would you say, is the least one? Like you still have to be like obviously very good at it, but it's not as important as oral and listening.
Yes, it's not as important, because I think technology have a lot of templates. It give you all the information step by step, very detailed. Consent forms are very standard. You just change the name of the patient. Anesthesia is the same. You just put your demographics, and the computer give you the. It's more verbal and listening. Oral in this specific job that is important.
What I have a question about that. For writing, I'm assuming it also have to be important when you're like having to write down like what kind of prescriptions you're maybe giving them, or like if a situation happened, you'd have to write down like where like in obviously like scientific medical terms, you have to carefully write down what part of the body it happened and make sure it's spelled correctly and everything. I remember having.
So in terms of medications, we do have technology now. The computers are
Oh wow.
basically pre-populated. So as far as you know, for example, amoxicillin, you put it amoxicillin, and then they give you according to the age, the weight, the exact doses, the exact time, the right doses, right time. You just put it the right patient. So there is a lot of methods that they double, triple check. You send it to the pharmacy. The pharmacy have the same system. They confirm that it's appropriate for the age, for the weight, so far and so on. So it's very, very specific. For the procedures as well, they're gonna tell you, first you clean the skin, put it this, put it that. It's very, very very technical. So you don't have to write a lot. It's just follow those steps, and that is automatically pre-populated in your report after the surgery. The only thing that is unpredictable is what you're gonna when you open, what you're gonna find, pathology, and things like that. But the first steps on writing are with the technology are already done.
Wow. So technology advancements have really helped. So then, I guess my question for that would be, what communication skills of those three would you wish you were better at, or that you could improve on, and why?
In that specific job, I will say the oral work, because you have to be able to adapt your language to any kind of person, independent of the level of literature, the level, if there is a professional, if there is not a professional. Also, translation. I hope that, when you have those patients, you don't have to translate because you lost a lot of information in those translation when you call the interpreter.
Interesting. And then, I guess, on that note, what kind of communication skills do you wish your coworkers, or maybe even your patients were better at?
I think for my co-workers, what I observe most of them is that part of empathy and compassion. Sometimes they deliver the information very straightforward. They don't take the time. Time is always here an issue. So sometimes people only need 5 minutes to hear what is going to be happening, but other people need to sit down, take water, repeat 2-3 times the same information. Wow. So in those ones, it's I wish that people understand more that every person is very different.
Wow, so like being able to not be a robot and like understand every situation is gonna have a different outcome, different process.
Compassion. Have more compassion.
More compassion. And how about your patients? Is there anything you wish the patients had better communication skills when it came to receiving these kinds of news and having to undergo these procedures?
Yeah, lately I noticed that they are more demanding. They think because we have some, or the system has some kind of payment rewarding, they can ask for everything. And like, for example, now it's not a specific diet. They want they think there is a photo of the hospital or the place that and they want it just, no, I don't want this, I want milk. A moment.
So their expectations are higher.
The expectations of the patients are higher because they see because there is a cost involved. They really are not aware that it's not a vacation, it's a hospital. It's not a hotel, it's a hospital center.
So just being more aware and like, okay, wow. Well, thank you so much for meeting with me. That was really informative. I loved that conversation.